Does stroke relapse? Stroke recurrence is a significant concern for those who have already experienced one. A stroke occurs when the blood flow to a part of the brain is interrupted, damaging brain cells. This can be due to a blockage in a brain artery, ischemic stroke, or bleeding within the brain, hemorrhagic stroke. It is not accurate that all patients who have had a first stroke will experience the second one. However, the risk of recurrence is indeed present. The recurrence rate is approximately 3 to 4% per year. The risk of stroke recurrence is about 7.4% within the first year and increases to 19.4% over 5 years. These statistics highlight the importance of managing risk factors and adhering to treatment plan to reduce the chances of a second stroke. After a stroke, also known as a cerebrovascular accident, a range of consequences can emerge, affecting the patient's life and health status. This is not only a personal issue but also imposes an economic burden on families and society in terms of patient recovery after a stroke. Some of the dangerous complications after a stroke include death. This is the most severe complication. With global statistics ranking it as the second leading cause of death. Every 40 seconds there's a stroke cases, and every 4 minutes someone dies from a stroke. The mortality rate for stroke patients in Vietnam is 50%. Motor paralysis. Up to 92% of stroke patients needing post-stroke rehabilitation experience motor disorder such as hemiplegia, loss of muscle movement capability. 27% of them suffer from lifelong disability. Cognitive disorders. More than 60% of stroke patients experience cognitive disorders, including memory loss and diminished cognitive abilities regarding their surroundings. Visual disorders. Stroke patients often suffer from vision problems, and in some cases may lose their sight due to the brain cell damage caused by ischemia or cerebral. Visual disorders. Stroke patients often suffer from vision problems, and in some cases may lose their sight due to brain cell damage caused by ischemia or cerebral hemorrhage. Sensory disorders. Numbness in the limbs can result from brain damage and circulatory disorders following a stroke. Language disorder. Speech difficulties, hearing problems, or loss of language abilities. Emotional and depression disorders. The psychological impact of a stroke can render a patient incapable of self-care, adding pressure on families and society. Sphincter dysfunction causes inability to control urination and defecation, affecting the patient's daily life. However, the adoption of preventive measures can significantly reduce this risk, with the potential to decrease it by up to 80%. Post-stroke patients need to monitor at home their blood pressure, heart rate, weight, capillary blood glucose, and diabetes if present. Regular monthly checkups are necessary to detect any cardiovascular abnormalities, such as arterial fibrillation, hypertension, and to assess blood test indicators, glucose, blood lipids, coagulation, if no anticoagulant medication. Never be complacent and always protect your health by providing your body with the necessary nutrients. In the next section, I will share about what nutrient should be supplemented to prevent stroke. Don't miss it.